Good day, everyone. I'm Moreno, a third-year medical student at Our Lady of Fatima University, and today I'll be demonstrating the proper application of a long arm posterior mold. Useful when transporting a patient to a hospital facility or when waiting for a definitive treatment. Temporary immobilization for injuries along the wrist, forearm, elbow, and distal arm, which is a beneficial for emergency settings since it reduces the swelling or further risk for infection. This long arm posterior mold with your elbow in flexion, extension, with your wrist in flexion, extension, neutral rotation, supination, and pronation. Plaster of Paris is used to immobilize broken bones while they heal. Stockinette is made up of 100% cotton. It is in contact with the skin to lessen irritation and keeps the affected areas clean. Wadding sheet is made up of cotton. It serves as a padding used to stanch the blood flow or dress a wound. Elastic bandage. It is used to secure the splint and to reduce the blood flow to a particular area by application of even stable pressure. It restricts swelling at the place of injury. Basin of water, preferably warm. It is where the plaster of Paris is submerged. Scissors. It is used to cut a material without injuring the skin. Arm sling. It is a device to support and keep still or immobilize an injured part of the body. Measure adequate length of the stockinette needed, which needs to be 2 to 3 inches distal to your fingers and up to the level of the shoulder area. Roll the stockinette inward for the convenience of the patient. To make a hole to expose the thumb area, make a small slit in the area of the scaphoid or wrist area. Application of wadding sheet. Make a small hole for the thumb along the wrist area, proximally with a 50% overlap of the wadding sheet. Add wadding sheet as needed. Make sure that there is enough padding along the elbow area. We will now be using our wadding sheet as the template for the length. Measure along the metacarpal area up to the distal arm or the supracondylar area. Preparing the posterior mold. Use the wadding sheet for 3 to 5 layers. Utilization of plaster cast. To activate the plaster of Paris, you need to dip it in the water. Make sure the bubbles have dissipated. That would tell us that enough water has seeped through the plaster of Paris. Once all the bubbles has dissipated, let it drip. Don't squeeze too much so that the materials won't fall off. Apply the plaster of Paris to the wadding sheet. Lay the plaster of Paris by rolling it to the prepared wadding sheet or template that was pre-made. Make sure it is flat. Repeat the rolling 8 to 10 times. And then cover it with a wadding sheet and apply it to our patient. Application of posterior mold. Place it to the patient and ask for assistance in holding the proximal end. Proper application of elastic bandage. The adequate tension of application of elastic bandage from wrist to arm area with a 50% overlap. For this initial application of elastic bandage, start again in the wrist area. Apply a little bit tighter than normal so that plaster of Paris would mold over the patient. Wait for it to set and harden up. After 5 to 10 minutes, after the mold has already set, remove the initial elastic bandage. Adjust your stockinette over the ends of the mold. Ask your assistant to hold the proximal end of the mold. Let's now reapply the elastic bandage. This step does not require you to apply it in a tight manner. Just place it as comfortably as possible for the patient. The purpose is just for the mold not to fall off. Secure it with a pin or adhesive. Application of arms sling. With an elbow which is bent at 90 degrees angle. Apply the arm sling with proper elevation of hand compared to the elbow and demonstrates proper locking of arm sling. This video is a return demonstration of a long arm posterior mold with elbow inflection and wrist in supination. Complications. A long arm posterior mold can have a possible complication that includes pressure sores, skin infection, dermatitis, pain and swelling, joint stiffness, discomfort, thermal injuries, compartment syndrome, and necrosis. The patient can have these complications if the cast is wrapped too tightly and overly padded molds can lead to these and inadequately immobilize an injury. Follow-up care. Follow up within 1 to 5 days for definitive care to an orthopedic surgeon. Patient education regarding swelling and vascular compromise. Also, recommendation for follow-up is crucial after cast application. Thank you for watching!